So it is 5:30 and a lot of people are back. So um, we're delighted to have Umair Azam, who's the CEO and founder of Innovative Healthcare Systems. And Umair, thank you for taking your time for this presentation. And we really look forward to hearing more about your company. And as you mentioned earlier, you are a serial entrepreneur in tech. You have worked in some of the leading tech companies in Pakistan as well. I was noticing on your background, you were COO of Inbox. Um, so we look forward to hearing more about your company. So over to you. You are the co-host, and this is also live on Facebook as well. So the format, like other presentations, would be that after your presentations, we'll do moderated Q&A, and then we'll be open for questions where people can put questions on chat, and Talha and I can read it over to you. So over
Perfect.
to you.
Thank you. Thank you so much. Thank you, Ali, and thank you the KSB team for inviting me for this conference. And I must say that I was able to join earlier. And like I said earlier, some brilliant ideas, some brilliant initiatives happening in the healthcare space in Pakistan. And I'm happy to be on this elite panel of people. I think we're very new to this space. I am a technology person, but then of course, healthcare is something that I've recently gotten into, and I think it's a great platform for me to talk about what we're doing and what we're trying to do. So basically, innovative healthcare systems, as you can see, is basically we're creating social impact through technology innovation in healthcare. And the idea is, I'll skip this. So we're all part of the emerging markets, as I call it, and challenges across emerging markets are probably the same when it comes to healthcare. Again, accessibility, cost, reliability, resources. Even doctors. Earlier I was going through some of the presentations that were being presented. I mean, the doctor to population ratio is just it's unbelievable, right? So and they're common across all these emerging markets. So we feel that technology and innovation will play a huge role in filling that gap. And we as technology people realize that the healthcare sector needs a lot of innovation, and this innovation will definitely impact in reachability. I think that's the biggest area that we're going to cover through technology innovation. So our aim is to use disruptive technology to basically make healthcare practical, accessible, affordable, and sustainable. And I mean, I like the word using democratize. We basically want to democratize healthcare for the common people. Just a quick snapshot of what the company is, who we are. So like I said, I'm part of many technology initiatives. Innovative Healthcare Systems is one of them. We have an advisory board in place where some of the renowned names of the healthcare industry are there. Dr. Babarasan, of course, leading name in pediatrics, especially in the coronary diseases. Dr. Razi Yusuf, again, one of the founder members of South City Hospital, and of course doing a lot of work globally in healthcare. Yamo is founder and CEO of iStock, which is one of the leading mobile diagnostics company in the world currently, and especially in the COVID days, they've really impacted and created a lot of impact through their technology. I'm going to talk about their technology as well, since we are an exclusive partner in Pakistan for it. So, like I said, we Innovative Healthcare Systems came into being around December 2019. We were part of, initially it was part of the technology venture that I'm running, but then we recently spun off this, and we made it a separate business entity because I thought the scope and the scale that this can go to is just unbelievable. We worked already in the space of diagnostics, and we've carried out almost 200,000 tests in the field. I'll talk about that. We have a few slides on that, and we're already signed some very innovative MOUs with AKU, and we're building some very interesting tech with them in collaboration with AKU's R&D wing. Again, what sort of prompted me to go into this space? And we 2 years ago we got into a healthcare project with the government of Sindh, and that's when I got exposed to the healthcare sector of Pakistan. Of course, as a common person, I was every now and then exposed to the healthcare system, but that was very privileged. We end up either at the top-notch hospitals of Karachi or Pakistan, and we get all the best type of services that are available. But when I was able to, through the Government of Sindh project, I was able to go into the field in places like Thar and Interior Sindh and Larkana and many other. I think we covered 70 odd places in Sindh. That sort of opened my eyes, and I was sort of exposed to the reality of healthcare and the condition of healthcare, where it was, and how the common man was suffering because of lack of resources, right? And one thing and because it was a technology healthcare project that we were rolling out with in collaboration with Government of Sindh, I realized rather that technology can play a huge impact. You just got to know the right set of tools and the right set of technology to sort of roll out and make people aware of it. So we all understand, the demographics of Pakistan, 220 million people, deficiency of hospitals, clinics, healthcare infrastructure. We all realize that, right? And we realize that with the emergence of 4G and hopefully 5G in the next couple of years, mobile health will play a huge role, right? And it will have a huge impact on the lives of people, right? So, and hence we decided to start this journey of getting ourselves prepared for that impact. And the idea behind this whole concept of innovative healthcare systems is basically to create impact using technology. Again, some facts to be stated here. This was a report done by Karandas, I think last year, and it's a published report, by the way. And it talks about this huge potential in Pakistan of almost 900 million pathology test market that it is, right? I mean, of course, having a population of 220 million people with a nucleus of almost 900 million, of potential market size of 900 million tests, you can imagine that how, again, the impact of mobile technology or technology can play in this huge market. And there's a lot to be captured, and there's a huge uptake in this space. So we started to work a couple of years ago in this space, and how we're progressing. I'm going to talk about that and what impact can we create. Again, the idea is only to sort of give people this. In fact, Karandas, what I understand, is already gone into this business, and they've started to set up pathology labs. So it's an impact project that they've started already. Of course, we have a different angle to it. We want to create disruption in this space. We don't want to go the conventional route. We would want to create disruption, and hence we're using a lot of partners in this space. Again, why we feel that infrastructure constraints enable mobile health, and the fact that why the mobile diagnostics can be a huge play. We all understand lack of access to testing labs. I mean, the moment you step out of the urban cities, the moment you step into the to the non-urban areas, that the quality of lab, the existence of a lab is not there, right? Forget about the quality. Quality comes next. People are not there. They're not, lab technicians are not available who can give you that service. The distances are huge. Sample degradation is a big issue. For the sample to travel to the city, there are no, infrastructure is not there. There are no temperature control vehicles which can carry the samples. I mean, there are many issues, right? So how do you address it? So is what we have started to work on. Again, I've spoken about this. I'm not going to spend too much time on it, but again, mobile health will have a huge play. And if you sort of bring the angle of AI and machine learning into it, it's going to disrupt the market in a big way. And we feel that it's already happening in many countries. I mean, if you look at our neighbors, India, the you know the technology in the field is already getting adopted by the doctors. Many doctors in the rural areas have already started to use this. I mean, I was watching a documentary a couple of days ago where, and I think it's an old documentary, where they've already put a vending machine in and it's sponsored by the government, where the people can actually go take their health card and go and dispense a any medicine they want based on the prescription that a doctor writes, right? So it's happening, right? So it's going to come. I mean, I was watching Sehat Kahani's presentation earlier, and they've changed the whole concept of how the smaller clinics are working in the field now, right? They've brought in remote doctors. The doctors are not there physically. They're operating out of homes. So all of this is happening, and it's not far where we're able to basically bring this change. Again, if you look at the global market, of course, the global mobile health market has reached about 28 billion potentially, and the fact that it's growing every year with a population of, almost 9 billion mobile subscribers. I mean, it's going to go crazy, right? At some point of time. So sorry. One needs to be ready for these numbers, right? So we need to as a country, we need to also be ready for adopting these changes the moment it starts to hit us, right? Again, our focus is going to stay, of course, in the emerging markets. We will prefer to work in the Asian and African market, and that's where we're trying to sort of increase our footprint. Of course, Pakistan is our I would say the first stop where we want to prove this model. And once the model is proved and we are happy as innovators, and let's say if we're able to attract more investors and bring them into this loop, then of course we would like to scale ourselves into the bigger markets or similar markets for that matter. So I'll jump into our portfolio, what we do, and the kind of solutions we carry. So one of them, the first one, this is of course not our product. We represent this product in Pakistan exclusively. It's called iStock. And the product iStock is basically, it's the world's first mobile diagnostics company. And they have designed a lab basically effectively out of a mobile phone, right? So you can basically um, get a result done for almost 60 plus infectious diseases in less than 2 minutes, right? So if I were to test somebody right now for something like a dengue or HIV, any infectious disease that you may have, you come to us. We will give you the diagnosis in less than 2 minutes using a smartphone application which is built on a artificial intelligence and machine learning algorithm. The technology is FDA approved. It's HIPAA compliant. Currently, in the post-COVID scenario, this is being heavily used in markets like North America, Europe, and many India and many South American countries, even some of the European countries. So we brought them here a couple of years ago, and we've been exclusively representing them. The largest project to date that we've done for them is what I was mentioning earlier, a project that we did with the government of Sindh Health Department, where we screened 120,000 people in the field across 70 locations in a matter of 30 days, right? And we were screening people for 6 infectious diseases. They were HIV, hepatitis B, hepatitis C, malaria, dengue, and chikungunya. I have slides in detail about that particular project, and I will go into them, but I thought I'll give you the context. So they're the world's first mobile diagnostics company. They call themselves as an IDA platform, which is immediate diagnostics and analytics. The beauty of this solution is that, because you're using a smartphone, you're able to capture the data digitally. Then you can link that data with any healthcare system. And then wherever you're out, and because you're out in the field, because this is like augmenting the conventional lab, because you can't take a conventional lab in the field, right? Because of the limitations it has. So I always give the analogy with this technology with something like how we used to, how the photography industry has progressed, right? So I remember when we were children, we would go to a studio to get our passport photographs done, right? And they would tell us that, you would get the negative and the processed picture maybe next day, right? And then similarly, later on, Polaroid came. Then that was more of an instant picture. Then today we are in an age where we get our pictures in less than 2-3 minutes because it's all digitally captured, right? So the entire industry got disrupted. So we know what happened to Kodak, for example, right? Because they did not sort of keep up with the with the technology trend, and they were eventually wiped out. While the Canons and the Minoltas and the other ones, they kept with the industry, and today they're thriving, right? In the photography industry. So similar thing we're anticipating is going to happen in the diagnostics market, where um, people are going to opt for smart labs. You see, uh, people want immediate result, right? They want a gratification, immediate gratification, right? So the fact that if, for example, at 12 in the night I'm feeling some symptoms of dengue or malaria or maybe COVID, for example, I want that capability to be available, where I walk into a smart lab which is operating 24 by 7, or I'm able to do it myself, right? Sitting at home, where I'm able to test myself with a reliable technology which is FDA approved, and it's giving me a 99.99% accuracy in the result that I take myself, right? So it just makes life, it just gives a different perspective, right? So This is where I was talking about the disruption comes in, right? So this is one technology that we're pushing a lot currently, and we feel that this is going to change the face of pathology in Pakistan, inshallah. The other technology that we've sort of built ourselves, and this is our own IP, is called Sentinel-4. The concept behind Sentinel-4 is to basically digitize healthcare records. Of course, we started with the vaccination records. So, as you know, in Pakistan or many emerging markets, there is no concept of digitizing the vaccination records. Today, also, our kids, when they're going to Khan or whatever hospitals we go to, it's all handwritten, the doctors maintaining a book where, there are no reminders, there are no digitally, captured records where you know that what vaccination and when and what age your kid is supposed to get, unless and if you've lost that book, then you've had it, because there is no way to go back and look for that record unless you call the hospital, and you go through tons of layers of bureaucracy and red taping to get that information out. What we thought was that how about we design a solution, because again, Pakistan has the highest number of infant deaths because of lack of vaccination, because kids don't get vaccinations on time, and because there are no records. I mean, I'm not questioning the capability or ability of the health workers going out in the field, but unfortunately, they're not able to cover the entire market, and even if they are, then they are not able to keep records of it, and no doctor, no government has detailed records. I think only polio is something which is kind of digitized now. Other than that, nothing else is. So we came up with this idea of, again, digitizing the entire vaccination record of each and every child of Pakistan. So we built this platform called Sentinel-4. It can work on multiple or with multiple sort of tech. So we've designed a pendant, which is a small pendant that would go in the neck of the mother or the child, and it has a small NFC chip. Basically, the NFC chip holds all the records. So every time a health worker would go in the field, they would just scan that NFC chip or that pendant. The most recent record of the child would come. They would see what was the last vaccination given to them, and then of course whatever the next one is supposed to be given, they do it, and they upload or they update the record. You need this data everywhere. You need this data when you want to go take an admission or put your child in the school for admissions. Every school wants this data. You're applying for visas, you want this data, where we've made the system capable to even now have, hopefully when the vaccination of COVID comes out, we could link this with the NADRA records. And every person who is going to get a vaccination, this record can be updated or linked with their NIC. So whenever you want to travel, you will be able to produce that document immediately. You don't have to go to any health department, any doctor, anywhere. This can eventually become part of your record, of your citizen record, basically. Because I think that's where we're heading as the world. I think this is going to happen very soon. So yeah, and then it is not just, like I said, it's not just vaccination. It could be any chronic, so you could trace and track your HIV patients. You could track and trace your TB patients, any chronic disease, hepatitis patients. I mean, we have plenty of them in Pakistan, right? So these are chronic issues, and all of these people can be tracked and traced through this application. One of I would say the closest to my heart is the application that we've developed in collaboration with Khan called ThalScan. So the concept behind ThalScan is that it is a AI engine that we've built um, uh, in collaboration with Khan to basically um, diagnose thalassaemic patients who go through the transfusion and all of that. They build a side effect of iron overload on the heart. Okay, and this is very common. It's very common in children, especially children who are thalassaemic, even older people. And today, the mechanism of identifying the iron overload because of the side effect of transfusion can take anywhere between 30 to 40 days, sometimes 60 days, depending on the load in the hospitals. So what we've done is that in collaboration with AKU, we have designed this AI tool, which is actually reading those MRIs and X-rays, and now diagnosing almost 90 plus percent with 90 plus percent accuracy, um, and reducing that time of 30, 40, 60 days to maybe a few minutes, basically. So we've already trained the model on thousands of MRIs and X-rays that we've been making our model to learn. So our model is quite capable now, and like I said, we're almost diagnosing at 90 plus percent accuracy. And of course, with the passage of time, the model and the data model will become more mature and will become more accurate. So this solution is ready, and we're looking to roll it out very soon. And again, the beauty of this is that you can take this product in the field. So you can design a small lab, which is like in a, again, bringing disruption. You can design a small lab, which is a mobile lab with an MRI machine inside the lab. And the moment you do the MRI, you don't need to have a doctor in that van. Our solution can actually diagnose straight away, reading that MRI, right? So, and same is the case if you have patients sitting in remote areas of the country and they are carrying their MRIs, they don't need to travel all the way to cities to get to just visit the doctor. And our solution can actually read those MRIs or basically recommend the doctor the the intensity of the iron overload. And again, this has started with thalassemia, and again, we are in talks already with the hospital to use the same technology for brain tumors. We're talking to them to use the same for orthopedic issues like bone cracks and other things, right? So, excuse me. So, so the idea is to again build technology which is going to bring disruption, and also increase the reachability, in the field. The next product that we have is called Critical. So Critical is again a project in collaboration with Khan and Islamic Development Bank. In fact, it is the only project that got approved from Pakistan by Islamic Development Bank this year. It has been given a grant to basically carry out a pilot where we design a mobile oximeter uh, for newborn children with certain additional features, right? So it needs to have a GPS tracking system. It's also not just going to read the blood oxygen saturation, but the body temperature, the sleeping pattern of the child. And again, the idea is to take this to the field, again, in the remote areas. We're not looking at urban cities, we're looking at remote areas where, again, the rate of death is very high for newborn children because they don't get the medical attention that they require. Again, due to the lack of infrastructure, a child is born, their body temperature is not being monitored, their blood oxygen saturation is not being monitored, their sleeping patterns are not being monitored, their blood pressure is not being monitored properly. So the pulse rate is not being monitored. So we're trying to build this one solution. So the entire hardware and software is being built by us, where it's going to be locally built and then, of course, manufactured, of course, outside at a at an approved WHO approved manufacturing facility for medical grade equipments, so that we can bring those back into Pakistan and start the pilot and then of course scale it up at a later stage. So these are basically the four solutions that we've built. Three we've built ourselves. The fourth one, of course, iStock, is what we represent as a company exclusively in Pakistan. This particular slide now talks about the project that I was telling you guys about that we executed for Sindh government, how we went about almost 70 locations across Sindh. We carried out 120,000 screenings. It was done in less than 30 days. Our cost of execution was almost 1/3 of the conventional lab. So for example, if a conventional lab charges 100 rupees for a dengue test, we were doing it at almost 30 rupees or 33 rupees. So 1/3 of the cost, right? Just because there is no infrastructure required. We just need a smartphone with a 3G or a 4G connection and our test kit. That's about it. You don't need anything else, basically. We covered, as I mentioned, we covered 6 diseases: HIV, Hep B, Hep C, malaria, dengue, and chikungunya. You can see this is all done in the field. So if you see the process, you prick a person in the finger, you take a drop of blood, you put it on the rapid test kit, and then you scan it with the smartphone application. The result comes in less than 2 minutes. And we can do this across 60 infectious diseases, 60 plus rather, infectious diseases, right? We can even do drug abuse testing. In fact, I am already in talks with the Ministry of Interior, because there was this talk around colleges and schools where there's a lot of drug abuse happening, and we've offered our services. We can actually do this. And again, because you don't need to have a huge infrastructure, it can be rolled out fairly easily. And during that project, we covered, schools, government schools. We covered central jails. We went into almost 6 jails in Sindh. We covered maybe more than 7,000 inmates. And we basically screened them for HIV and hepatitis, because the problem is that if a person inside the jail is infected, there is a likelihood that, and because of the close proximity, there is a likelihood that they're going to affect other inmates as well. So again, the government of Sindh, or the Interior Ministry of Sindh, is looking at making this a standard that every time a person comes into the jail, if he's a convict or if he's being charged, they need to go through a series of tests to get themselves cleaned or cleared before they're put into the cells. We were in smaller towns and gaon dehat, literally villages, where there was no light, but we were still able to execute the testing. This is, I think, the image that you see where you see my mouse. This is probably happening at 1 a.m. I remember. So that is the beauty of this technology. Again, just a quick slide on ThalScan. I'm not going to go into details of each and every technology we were building, But the beauty of ThealthScan is, like I said, what we should be proud of is the fact that this entire tech is being built in Pakistan. The entire AI engine is being written in the lab of innovation healthcare systems under the supervision of AKU experts, doctors and experts who are guiding us throughout the process. And inshallah, we will be rolling this out very soon. AKU is very, very happy with the results, the clinical results they've seen. And so this is going to be a big, big landmark for us very soon. Um, Again, this talks about how we are catering to the 4 stages. Stage 1 is the classification of the short axis images. Stage 2 is discarding blood, T2 sequences. This is the process how AKU wanted to do this, segmentation of heart. And then, of course, stage 4 is when we're exactly estimating the T2 star value or the exact amount of iron overload on the heart. So this is a serious issue in mostly all the emerging markets. So Pakistan, not just Pakistan, but many other. How we're sort of smartly scaling ourselves or looking to scale ourselves in markets like Asia and Africa. We want to identify the potential partnerships. We want to target the ecosystems like the governments and hospitals, donors, doctors, pharmacies, consumers. The model is going to be for sure both B2B and B2C. In fact, in some cases, B2G, which is business to government. And I even use the word B2D, which is business to donor, because they're investing a lot in similar initiatives. And then we'll roll out the localized support and service delivery. We want to go into, at some point in time, a franchisee model where we want to appoint franchisees who can actually run this entire portfolio, right? And this portfolio, by the way, is increasing. Every quarter, we're adding a new product to our portfolio. There's a lot of learnings that are happening with the R&D and the IP creation and the innovation, especially working with the likes of AKU. In fact, in this particular project of ThealthScan, there were people involved from Johns Hopkins and Boston Children's Hospital, also consultants who have given their input into that product. We are building key partnerships. We're looking for products which are suitable for a country like Pakistan and many other emerging markets, which are actually solving the problem, right? What is our USP? So we're looking for, or we're building, products which are going to be globally benchmarked products, so that we can go through faster approvals of regulatory compliance and all of that. We are looking to market to full spectrum, which is consumers, doctors, clinics, and hospitals. We're not just focusing ourselves on public sector alone, where we want to go into public sector, we want to go into private sector, we want to go into the donor space. We're looking to set up labs, like I mentioned earlier, smart labs. I have a slide on that too. We're going to keep adding products in our portfolio. We're looking to internationally expand and taking that local playbook, which is repeatable, right? It's because if you've had success in one market, it's very easy to go and replicate the same story in a similar market. Again, we're continuously investing and building our own technology team. So we're not dependent just on third party. We're building our own capability, especially in the space of AI and IoT and machine learning, mobile applications. Whatever you've seen today has a huge social impact, because the fact that, the kind of disruption that we're looking to create in the diagnostics market or in the vaccination market, or for that matter, thalassemia, or using AI for diagnosis, it all has a huge social impact. We are, of course, like any technology company, we do look at a exit potential, and we prefer to look at it from a product standpoint, not just a complete exit, but we would like to use or build a story around a product-wise exit plan. And like I said, it is almost a near risk-free investment in a high return segment. Healthcare is by far, I think, the highest return segment, especially post-COVID. It's kind of proven now. A lot of deliveries done. So our team was in Qatar last year, and we won the KitCom hackathon. It was an all-girls team from our company that won the hackathon in Qatar. It was sponsored by Microsoft, and these girls actually went and they presented a technology for physically disabled people. It is now being incubated under the Qatar government, and the idea is now being developed, and hopefully they will launch the product, which is being incubated under their leadership. I've already mentioned the 120,000 screenings being done by using iStock for the Department of Health in Sindh government. We have been the partner of the year under the SME category for Global Compact, which is a United Nations Global Compact. The 17 sustainable goals that are being sort of pushed out in the emerging markets. And then, of course, our innovation lab, which is already set up in Karachi. Proof of concepts done locally. So we've done Abbasi Shaheed. We did 1,000+ screenings over there. We did Congo virus screening. So we have animal testing as well on a similar pattern, like human testing, basically. So it was already done last year. We did this project for the Karachi Metropolitan Corporation. And I was mentioning to you about the Central Prison Project, Government of Sindh, and we went through multiple 6, I think, prison facilities. Again, a lot of media coverage. So we were in small towns, we were in hospitals and clinics, we were in small villages and all of that. So I think this is probably my last slide, where it talks about why we're looking for funding, or what is the plan for funding. Of course, I mentioned it earlier, but I think this slide particularly talks about how we're looking to bring disruption in the smart labs business, right? Why we're looking to bring smart labs. So you can clearly see that the conventional lab has its own challenges, while the iStock mobile diagnostics, you can reach out to basically hundreds and millions of customers through the technology, right? Because everybody is carrying a smartphone, everybody has access to the internet because of, again, 3G, 4G. It gives you instant gratification because it's able to give you results in less than 2 minutes. Today also, I mean, we have a test now where we're claiming, iStock is claiming to replace PCR test with their mobile diagnostic test. And again, the technology is going to give you a result in less than few minutes, right? It has already started to roll out in many countries, and hopefully we're soon going to bring that into Pakistan as well. I think this was my last slide. Talks about. So I hope the presentation I was able to give you guys what we're doing and how we're using technology to bring some new angle to the healthcare business in Pakistan.
Absolutely, it's extremely innovative and very valuable. I close to my heart what you're doing, because my mom passed away because of hepatitis C, which was never diagnosed
so
within 20 years.
So
Thank you for saying that.
Yeah.
But yeah, so I totally see the value. Like, this is so important, the kind of stuff which you're doing, because, like, all kinds of disease get untested, because testing is not easy. So I'm sure this is
Absolutely.
not just a Pakistan problem; it's a global problem, but certainly needed here and everywhere. Thank you for that presentation. I will certainly look for your product. I'm sure it will have a massive
Inshallah.
impact. Uh, um, can you tell us a
That's
bit
what we
about your?
believe in.
I'm sure it will. Can you tell us a bit about your corporate structure? Is the company
Sure.
based in Pakistan? How many people do you have? How many work
Sure.
in tech, especially in AI? You know, uh,
Sure. S- Right. So yeah. So the company is very much based in Pakistan. We incorporated the company in Pakistan as well. So I'm the founder member, and currently it is being invested by myself and of course our parent company or parent or a sister concern, which is called Integration Experts, which is the technology arm also. But that's more on the conventional technology arm. They're not into healthcare. They're more on the enterprise space technology. Currently, we have a team of almost, I would say, 15 odd people in this company today. But it is purely from because we're creating all that technology today, right? And the reason why we're looking to raise funding now is to basically go into this massive say of build this massive sales engine, which is going to go out in the field and start to disrupt. Because now we're ready with the technology. I think we're carrying some of the world's best technology when it comes to mobile diagnostics. Like we're carrying the world's number one technology company in our portfolio. Other than that, the technology that we're building in collaboration with Khan, for example, has again a huge potential. So we need to now, we've got the tech in place. We've got the AI team or the data scientists that we have. We have a team of about 5 or 6 data scientists that are building this tech for us. We're now looking to raise basically investment to go and build, like I said, a sales engine which is going to create that pipeline or create that impact, work with, because like I said, we want to work on the full spectrum, which is the doctors, clinics, hospitals, NGOs, private sector, public sector, and we want to go and educate people and, of course, start to sell and push our products for a bigger use. Uh, so yeah. So today I would say it's a team of, if I say a total size, we're probably just under 20, including our techies and our bit of our corporate, back office, as we call it, right?
and what's the size of your business right now? What's the revenues, and where do you think, and what's the
Uh,
growth been?
so I think, you see, since we just got incorporated in December last year, I can tell you that the revenues are not bad. I mean, I think we're going to close. So we're going to close our year in December now this year, and we're going to be, I would say, um, just break even. I would say, so it's not going to be a profitable unit, but we will just break even this year. Um, the growth looks phenomenal because, like I said, if we're looking at just on diagnostics, for example, for iStop, right? We're looking at, I told you the Karandas report mentioned something like 900 million tests, right? And the fact that if we are able to even capture, maybe 0.1% of that market size, we're looking at a probably a growth of, I don't know, maybe a couple of 100% in the following year, right? and it's going to keep increasing, right? Because the infrastructure issues are going to increase, the reachability is going to increase, the issues with reachability is going to increase, and with COVID and a lot of uncertainty around it, I think everybody would like to basically do the first line of self-defense themselves. So if somebody in my house is feeling, for example, symptoms of dengue or malaria, if I have that capability or that opportunity or that technology where I'm able to test myself at home, I would probably do that. I would not like to take my child or my mother or my, whoever in my house to the hospital, because, we all understand the challenges around that, right? So, and especially when the technology is globally approved, it is an FDA approved technology or solution. So, you don't have any doubts, and they give you almost 99.99% accuracy on the result. And we have already proven that locally, where we have taken samples from the lab and tested them on our technology and given them 100% compliance.
Absolutely, you're
Since
totally right.
government, yeah,
I think
yeah.
you're right that post COVID, everybody realizes the importance of their healthcare, and testing is important. And as you said, nobody wants to go to the center, to the hospital. So clearly, this is something which they
Preferably,
all
yes.
need. Um, I'm just conscious of time. We're actually over the time,
Sure,
but
sure.
we're open for questions. So please, if you have questions, write it down on chat, and I'll read it to Umair Saab. I published a report on the key themes for 2021 for investment perspective, and one of those is healthcare, and exactly the kind of stuff which you're talking about. So so I totally hear you, and I am certainly a believer in terms of the significance of what you're doing.
Absolutely. No, I appreciate that.
And in terms of the capital raise, can you give us a sense of what's the amount which you want to raise?
So we're looking for, of course, staggered investment. So we're not looking for anything, whatever we're looking to raise straight up or upfront. We would like to stagger it over 12 to 18 months, basically. And currently, we're looking at an amount of anywhere between $2 to $3 million. And we have a complete deployment plan for that, how we're going to basically use that money or deploy those funds over the next 12 to 18 months to scale this business, basically.
Got it.
Yeah.
So just following up on Ali's question, are you guys open to raise debt capital as well?
We're open to raising debt capital as well. Yes. We're okay with that.
Oh, okay.
Right.
Thank you so much. This was extremely interesting,
No.
and I think you're doing a great job. And as I said, I will certainly want to buy your product, and and I'm sure that it's a very easy sell. And we all know that the power of AI in terms of predicting and disease, the applications which you mentioned in terms of, I'm sure there are multiple applications.
Yeah. So we just started with thalassemia, but then of course we're going into many other other areas with the likes of AKU and many other organizations.
What are the challenges? What are your biggest challenges?
So I think for me, because I've been going in the market and meeting a lot of people. I think the challenge of that I see, especially the caregivers, the healthcare professionals, is their confidence on technology, or I mean the fact that they're also scared that maybe technology will replace a lot of them, right? And hence there is an immediate pushback, right? While my pitch is always on the lines that, we're looking to augment their effort. We want to basically bring more efficiency. We're not, like I said, honestly, I'm not saying even with this mobile diagnostic, my view is that, we will never be able to replace the labs. But what we can do is we can actually augment them and bring more efficiency. So, for example, when there is an epidemic, something like, what is happening right now, COVID, right? Now, we understand the labs don't have the capacity or the capability. If God forbid, tomorrow we come to know that, 200,000 or 300,000 people need to get tested in Karachi in a single day, or let's say over the next 3-4 days, the labs are not equipped. They're not able to deliver, right? While we are saying that, if an angle of technology is brought in, which is technology which is efficient, which is globally recognized, and if we are able to, because I was mentioning to you that we were doing in a remote area of Sindh, we were doing 5,000 tests a day, right? Almost. So if we have labs where we go and we augment them, and we deliver the first line of defense, for example, we do the screening, as we call them, and people who are coming positive, right? So first of all, the cost of doing this test is much lower. So for example, if you're spending 7,000 rupees on a PCR test or 6,000 rupees on a PCR test, we're doing the screening at maybe 1,000 rupees. Okay, right? So we screen the people. The people who are coming positive, we send them for detailed testing to the lab, while the rest of them are sent home. And the cost model becomes affordable for everyone. The person today, many people don't go and get themselves tested because of the fact they don't want to spend 6,000 rupees, and because the fear is, what if I'm negative? The 6,000 rupees goes to waste, right?
Yes, no, certainly. I think this is a no-brainer, and I think you're being. I've seen statistics which show that actually AI are better in predicting and diagnosis than humans are. So I think
Absolutely.
I'm sure that the pace at which technology is growing, that and AI is training itself, your systems will be much superior than humans, and it will remove
They
human
are.
errors.
They
So they're
are.
cheaper,
Yes.
they're more efficient. For a country like
Of
Pakistan,
course.
it's a no-brainer because we can, as you showed the statistics, that we cannot have any other solution. So this is actually a kind of a miracle for a country like Pakistan, where this can actually be used to solve a huge medical problem. So thank you so much for your presentation.
No,
Uh,
thank you, Ali. Appreciate it. Thank you.